We're going to turn to COVID numbers in Michigan. They may be about to go from bad to worse. Good evening and welcome to 7 Action News at 11. I'm CAROLYN Clifford. We are already breaking records and the state is bracing for a significant increase in the next 10 days. Tonight, 4,580 adults are battling COVID-19 in Michigan hospitals. That is about 60 more than the pandemic record set just last month. The state also confirmed 44,500 new infections in the last 3 days. The daily average under 15,000 is down from the record 20,000 on Friday. But it seems Omicron is just getting started here in Michigan. 7 Action News reporter Brett Cast is digging into the impact.
Well, right now, Beaumont Health System has their second highest number of adults in the hospital with COVID-19 throughout this entire pandemic, only behind the surge of April of 2020. But doctors say those who are sickest tend to be unvaccinated, and not everyone in the hospital with COVID is there because of COVID. With infections reaching all-time highs, Omicron continues to spread unlike any previous variant.
The system's at its breaking point at this point. A little more and it's going to tip over.
On Monday, the state of Michigan reached a record for hospitalized adults with COVID-19, despite the fact that Omicron appears to be less severe.
It is translating to a smaller percentage of patients, but we have a larger pool of patients getting, contracting Omicron. So it potentially could be more than we saw with Delta.
State Health Director Elizabeth Hertel says according to the state's models, the peak still has not been reached, and cases will continue to climb for the next 2 to 3 weeks.
I think people need to be prepared to see our case rates increase significantly over the next 10 days.
As for severity, about 18% of those hospitalized adults are in the ICU. And Dr. Sims cautions since every patient at the hospital is tested for COVID, even those with mild symptoms hospitalized for other reasons count as hospitalized COVID patients. And with Omicron spread and sometimes mild symptoms, it's happening more often.
Are you saying that's something that kind of may add to the numbers, or is that something that is like a very rare situation?
No, that's definitely adding to the numbers. A certain percentage of our patients who are in with COVID are not sick from COVID. They're sick from other things, but we have to deal with their COVID also.
And on Fox News Sunday, CDC Director Rochelle Walensky also said the same thing.
In some hospitals that we've talked to, up to 40% of the patients who are coming in with COVID are coming in not because they're sick with COVID, but because they're coming in with something else.
But Dr. Sims says this doesn't change the fact that many people are still very sick and dying with COVID. He's encouraging the vaccine and booster shots, saying those very sick patients are almost always unvaccinated.
It'll break through, especially if you're not boosted. You'll get infected. You may even get a little bit of symptoms, but you don't get that sick.
Now, Dr. Sims reiterated that if someone is in the hospital for something other than COVID but still tests positive for COVID, it is very challenging for staff because that patient now has to be isolated and staff has to also wear the proper PPE. In Royal Oak, I'm Brett Cast, 7 Action News.